Even spending just a few minutes on the phone with a senior can go a long way toward reducing feelings of loneliness and isolation. This is especially important for seniors who are living alone, in addition to those who are in residential care facilities. All of us can make regular phone calls with our elder loved ones a part of our new normal. I know that the measures we have put in place continue to strain families, business, and all of Alberta. I must reiterate their importance. If you are feeling sick with fever or cough or even mild cold-like symptoms, you must stay home and away from others. Those who have returned from travel outside the country must stay home for 14 days after their return, even if they are feeling well. Measures such as restrictions on gatherings and closure of the types of businesses that we have previously announced must be followed. And while those who are feeling well and haven't returned from traveling can be out in the community, be sure to wash hands frequently and stay 2 meters away from others as much as possible. My team and I are receiving many questions about applying these measures to people's daily lives. One question has been about whether it is safe to be outside when someone is self-isolating. I want to be clear that there is no danger to others if someone who is self-isolating goes for a walk outside and stays 2 meters away from others. Being outside and active is an important support for health, both physical and mental, and should be encouraged. With respect to other activities, I know under normal circumstances, many Albertans would be gearing up to visit their local farmers markets this weekend. At this point, these markets are in the same category as grocery stores and shopping centres and can remain open. But again, I urge you to practice social distancing and excellent hand hygiene if you leave the house. Another question we have received is about funerals. For those experiencing the loss of a loved one, funerals may still be held, providing there are fewer than 50 attendees. But you must maintain social distancing. Anyone ill, even with mild symptoms, must not attend. I know it is heartbreaking to refrain from hugging loved ones at something as difficult as a funeral. But please trust that these practices, as painful as they are necessary to prevent the spread of this deadly and contagious illness. Finally, I want to share some stories that Albertans have shared with me through my Twitter account on acts of kindness during these extraordinary and trying times. Stories of neighbours taking the pet of someone in self-isolation to the vet so the animal could receive care, organizations going above and beyond to help travelers get home safely, people taping drawings and paper snowflakes to their window to brighten others' days. And I want to thank teachers for their continued work in supporting students' learning. Others are simply reaching out to people who are struggling, whether it is online or over the phone. Albertans are responding to this extraordinary situation in extraordinary ways. Please continue to share your stories using the Alberta Cares hashtag. Continue to take care of each other and yourselves. The importance of self-care in these uncertain, stressful times cannot be overstated. With that in mind, I will be taking some personal time this weekend to rest and recharge, and my colleague, Deputy Chief Medical Officer of Health, Dr. Marcia Johnson, will provide tomorrow's update so I can spend some time with my family. Thank you for your support as we respond to this serious situation. Thank you for supporting each other. I look forward to joining you again on Monday. Thank you, and I'm happy to take questions.
Okay, shot.
Sorry, we're just going to have brief remarks from Deputy Minister Johnson. Sorry, Winnick, and then we'll begin.
Good afternoon. I'm Paul Winnick, the Deputy Minister of Municipal Affairs. And as you know, the province of Alberta is facing a major challenge with this outbreak. As part of the government's response, we are making amendments to the Emergency Management Act. The Emergency Management Amendment Act will allow local and provincial states of emergency to exist at the same time should we ever require to declare this. Under existing legislation, the Alberta government, when it declares a provincial state of emergency, takes charge of all local authorities. This effectively nullifies the local declaration in response, since two emergency declarations cannot exist at the same time. Amending this section of the Act will help communities and the province respond to emergencies according to their respective levels of responsibility and expertise. This amendment provides clarity and improves the coordination of local and provincial response efforts in the event of disasters, not only the current pandemic, but should there be wildfires or floods in the future. And of course, beyond the COVID-19 outbreak, Alberta has now entered the natural disaster season. Allowing individual communities to run their own states of local emergency will ensure the province is ready and able to respond to additional emergencies and disasters should the need arise. Alberta has been through significant emergencies and disasters in recent years, including major floods and fires. Because of these experiences, we're able to work seamlessly with our emergency partners across the province and across the ministries. The Emergency Management, the Amendment Act, will help to ensure the best possible response at all levels of government to the challenges that we face now and in the future. Thank you.
All right, we'll now open to questions. We got Dean and then Tricia.
Dr. Heath, on two topics today. One is the ICU cases. Could you put some more information on that in terms of the circumstances of them? And is there anything we should draw from 5 ICU cases out of 190? 5 cases altogether.
So I have basic information only. As you know, things change very rapidly, and so we're drawing our data summaries now through our administrative databases because, as you know, with this many new cases, it's impossible for me to get a personal phone call with a description of each of those cases. The information that I have at this time is that we have 1 case in their 40s and 1 in their 60s. Those were 2 that had previously been reported. Of the new ICU cases, I believe 1 is in their 70s, 1 in their 60s, and 1 in our administrative database did not have the age recorded, which again, sometimes the investigation takes a while to then populate through our systems. I think what I would say is that we knew this would happen. This is why we're taking these extraordinary measures. This shows that this is a virus to be taken very seriously. We continue to do everything we can to prevent every single case, and every single case is one that could potentially end up in a serious condition. And so again, while we only have these 5 right now, again, it's a signal that we need to take this extremely seriously.
Might be a question for Dr. Duffy. Can you update us now on the Bonspiel doctors? How many Alberta doctors was it? Have they been notified? Are they now self-isolating? And do you see, given the specialties they have, that this could have any impact on fighting COVID?
So that investigation continues to be underway. So I'm working on getting the additional details. My understanding is that today Public Health is getting those lists and contacting all of those doctors individually who may not have heard the public appeal, and making sure that not only does the organizer, who I think has reached out to all those individuals, that Public Health actually has their contact information and has an individual conversation with each one of them. So that's happening today.
You might be having these Bonspiel doctors out there practicing today.
So again, my understanding is that the organizer has notified everyone of the requirements, but Public Health does need to do that individual notification. So again, I would hope that the doctors who are in the situation are following the recommendations, and we're going to make sure that they understand that. But again, it just takes time. We were notified of this yesterday. We're getting the list. We're making those phone calls. But it's really only been a little over 24 hours since we were notified.
Tricia?
Sort of following up on that, we've gotten a few tips about people in quite powerful, not powerful, high up positions at key facilities that might have been there. Is there any concern about exposure for patients or anything?
That's a part of the investigation that's happening right now. So obviously, if someone was there, became ill and worked while ill, that would be a significant concern, but I don't have those details. That's something that we're investigating.
Excellent. One more and then we'll go to the phones. Dylan?
We saw just about 95 cases or so in about the first 12 days. In about the 2 or 3 days since, we're now at 195. Are these numbers surprising, or is this sort of par for the course?
So the majority of our numbers are still from people who've traveled from outside the country, or those who are close contacts of those people. So I would say that this is, again, evidence of that public health containment in action. So many of those close contacts are people that we had notified informed them to be on self-isolation, and when they became sick, they were tested and were confirmed. So again, the measures that we're taking are really those to contain that. So of all of those cases that I talked about, again, our number today is 11. I think that may change a bit as we do investigation and we may find a connection that wasn't immediately obvious. But certainly it's concerning. Every single case that we get is one that needs to be contained. And the ones that are most concerning are the ones that are showing up that haven't been staying home while ill and have put others at risk. So again, over and over again, that key message, when anyone is sick, they must stay home.
So we'll go to the phones and we'll definitely come back to the room. Operator, could you patch through the first question?
Our first question comes from Emma Graney of the Globe and Mail. Your line is open.
Yeah, g'day. I've got a question and a follow-up here. We're hearing of a possible case at an Alberta oil sands camp. Now, I understand you can't give specific details, but I'm wondering if you can speak a little bit to the worries you might have around these places that are close living quarters. They have buffets. You know, they're at risk, really, of spreading germs pretty easily. What's your advice to them?
So with respect to work camps, there certainly are measures that those places can put in place, especially with things like a communal dining area. And so they can have people potentially eating in different shifts, sitting apart from each other at tables. Buffet style serving should be discouraged, so there shouldn't be a common handling of serving utensils. So there may be changes that are required in those places, but certainly there are measures that they can take to reduce the risk. With respect to you indicated there might be a report, that's not something that I have heard. I'm not aware of a case in the work camps. So again, I know that local public health, when they do get cases, they do that investigation. And if there were to be significant risk beyond immediate close contacts, we've asked for local public health to notify us, and that's not a notification I've received.
You said you had a follow-up there, Emma?
Yeah, I do. Now, this actually moves over to the change they made with the state of local emergency. I'm just curious there, whose direction is the most powerful? Will provincial direction override local direction? Because you might have some municipalities where, for example, you know, the town council is convinced it's all a hoax, doesn't really exist, and so therefore they're not willing to do anything. Would the province direction override that silliness?
In that case, and I don't think we would ever run into that case, that extreme example that you've mentioned, but absolutely the provincial direction, if there is a discrepancy, would override local direction, but we would work very hard to ensure that things are synchronized.
Excellent. Operator, could you pass through the next question, please?
Our next question comes from Myrna of CBC Radio. Your line is Canada.
Actually, sorry, someone just asked my questions. It was about the workers' camp. I'm good.
That's no problem. Yeah. Operator, could you patch through the next question, please?
The next question comes from Kevin Nimick of CTV Calgary. Your line is open.
Hi, Dr. Hinshaw. I have a question and a follow-up. So today we learned a staff member at a Calgary McDonald's contracted COVID-19. Is it still safe to buy food from restaurants, be they fast food or dine-in?
So again, I'll say that I don't have that specific information. I know you're not asking me to confirm that case, but I would caution all of you, if you're getting reports, that sometimes those reports are simply of someone who is sick and is being tested, and they may not actually be a confirmed case. So just that caution in terms of verification. With respect to the safety of eating food from restaurants, so this is not a foodborne illness. So one of the things that if people want to be as safe as possible, we talked, I think in a previous media availability about, is it safe to order in food from restaurants? So we talked about the fact that if you order in food, to be absolutely safe, you can transfer that food into your own dishes, wash your hands. But again, the likelihood that you would be